The statistics have been depicting the following picture. For instance, in the month of March, we tested 3,419 samples, of which 78 were positive. In April, we nearly quadrupled this number, testing about 19,108 samples, of which 328 tested positive. And in the month of May, again, quadrupling this number, we tested 57,527 samples were run, of which 1,615 were positive. And in the month of June to date, we've tested 85,142 samples, of which 4,049 have turned positive. And from these figures, it is clearly evident that the number of those testing positive has been on a sharp increase. And this really should worry each and every one of us, because it's obvious and it's a bad indicator that the situation is getting worse within the country. And it is important, again, as we've emphasized over and over again, to ensure that we adhere to the containment measures. And even as we do this, it is important to note now that the fight and the frontline soldiers, in terms of spotlighting, has turned to the counties. And the counties now need to bear responsibility to be able to ensure that we are able to combat coronavirus. And to this end, counties need to move with speed to finalize their levels of preparedness. As of now, working together with county governments, we are working to enhance capacity of testing, tracing, treating, and isolating. And as we move forward, we do expect each and every county government to be able to roll out this intervention, to be able to enhance their testing capacities at county level. And this includes both laboratory testing, but also syndromic surveillance, to be able to have proper contact tracing mechanisms in place. County governments need to deploy rapid response teams. These teams need to be agile and they need to be able to be supported to ensure that they can trace appropriately. And of course, treatment facilities need to be readied in terms of being able to receive any sick or severe patients and ensuring that our isolation and home-based care program are efficiently run. In the meantime, we would like to continue urging each and every one of us to continue, again, seriously observing all the containment measures. And to remind people that really there is no alternative strategy. There is no other mechanism in place. As we've said time and time immemorial, it is up to us to be able to wash our hands, to maintain physical distance, and to be able to mask. Those really are the alternatives or the measures that we have in place right now. Another key element that we feel we must emphasize is that it becomes very important to have personal responsibility as each and every Kenyan, and therefore expecting law enforcement agencies to compel us to observe these measures can only help in creating an environment where the virus will thrive and get out of control. There are those of us who only wear the mask when in the vicinity of law enforcers, only to remove it immediately after. And there are those of us who actually also don't wear the mask correctly. And there are those of us who have very low regard to the social distance requirements. And it is important to note that this, again, is a recipe of disaster, and we really do have to take personal responsibility. Turning on to our COVID-19 situation, today we have tested 2,718 samples, out of which 259 people have tested positive for the virus. The cumulative number of tests conducted so far stands at 165,196,000, and the total caseload for the country right now is 6,070. So we've now surpassed the 6,000 mark. All the positive cases are Kenyans, except 3 foreigners, 159 being male, 100 being female. And in terms of age, the youngest is 8 months old, whereas the oldest is 92 years. The 259 cases are distributed as follows by county: Nairobi leading with 127 cases, Mombasa 39, Kiambu 22, Machakos 16, Busia 11, Makueni 9, Nakuru 9, Uasin Gishu 9, Kilifi 5, Kajiado 3, Kisumu 2, Lamu 2, Garissa 2, Marsabit 2, and Kwale 1. And in terms of sub-counties, again, I'll jump into the key high-load burden areas. In Nairobi, out of the 127, Westlands, again, is leading with 31 cases, Dagoretti North, 22, Makadara 12, Embakasi East and Langata having 11 each. In Mombasa, the 39 cases are from Likoni. We have Likoni, having 13 cases, Mvita 8, Changamwe 7, Jomvu 6, Nyali 4. And in terms of Kiambu, the 22 cases, 8 from Thika, 6 from Kiambaa, 4 from Kiambu Town, Juja, Kabete, Lari, and Riru all having 1 case each. In Machakos, the 16 cases, we have 15 from Athi River and 1 case from Machakos Town. In Busia, out of the 11 cases, from Teso North, we have 9. In Makueni, the cases that we have, Kibwezi West has 7. And in Nakuru, out of the 9 cases, in Naivasha we have 4. In Nakuru East, we have 3. Rongai 2. In Wasingishu, we have 3 from Ainakeboi. Kapsaret and Tubo have 2 cases. And in Kilifi, the 5 cases in terms of disaggregation, Kaloleni and Kilifi South have 2 cases each, and Malindi has 1. And in Kajiado, the cases are in Kajiado North, where we have 2. Kajiado Central, we have 1. Lamu is the latest county to report a case, bringing the total number of counties in the country that have COVID-19 cases to 41. So we now have 1 additional county, that's Lamu. We are happy to report that we've discharged 35 patients from various hospitals, bringing the tally of recoveries to 1,971. Unfortunately, we have lost 2 more patients to the disease, bringing the total number of those who have succumbed to 143. And our thoughts and prayers are with the bereaved relatives and families during this difficult time. We thank you. Questions?
Thank you. My name is Ben Kirera from K24 TV. And my first question is based on the ICT sector. How effective is the training of the 60,000 community volunteers in regards to ICT? And also, are they able to get the PPEs, seeing that we've had cases whereby nurses in hospitals are not able to acquire the PPEs? And my second question is on the samples. For example, the over 2,000 samples tested today, or rather sampled. When are these samples collected before they actually undergo testing? Do you collect the 2,000 samples and do the testing, or are they collected prior to the testing? And how prior is it? Thank you.
My name is Helen Aura from NTV. During the Corporate Council on Africa Leaders Forum, the President hinted on the reopening of the economy and as well as domestic flights. Does this mean that even as a country, where are we in terms of our state of preparedness? Are we telling the common Mwananchi that we have everything under control as a country? And my second question is regarding the 300-bed capacity. During our 100th briefing with the CS, he promised and said he mentioned in the next week or in the next 2 weeks, every county will have the 300-bed capacity. But from what you've just informed us in terms of now every county and state of preparedness, does every county, have we fulfilled that promise of the 300-bed capacity? And what counties particularly are we looking at right now, which maybe still have not been fulfilled that promise for the 300-bed capacity? And the last question, I will never get tired of asking it, with the leaders still flaunting the measures of wearing a mask and social distance during these gatherings that they hold, and recently even with the Kakamega leaders meeting that we saw that happened, and the CSs also being there, and yet for the common Mwananchi, it still remains to be an issue. Where do we stand?
My name is Purity Museo from KBC. My question is on how many facilities do we have in the country that are COVID-19 response facilities that can treat or take care of patients of coronavirus. And again, on the counties, you said that counties should be able to test and also treat. Again, how many counties that have that capacity? The other question is on people have lost their jobs and they are at home, and there are struggles with rent, and there are those who wish that they go back to mashambani or rural areas because they cannot afford rent or even staying in Nairobi. So is there anything that you are doing to address that, even as we look forward to having these restrictions revisited maybe in a week's time after the 30 days deadline? Lastly, how many infants have tested positive for coronavirus?
Naitwa Haimba kutoka Ebro TV. Labda swali langu ni kuhusiana na Aura vile aliweza kuzungumzia. Imebaki takriban juma limoja kabla ya serikali kutoa mwelekeo yapo utaweza kufungua mji wa Nairobi au mji wa Mombasa na mji wa Mombasa. Na mwezi wa Juni umeweza kushuhudia maambukizi mengi na huenda ikaongezeka hadi mwezi wa Juni na wa Julai na kuendelea. Je, mna kama wataalamu wa afya mnaona ni kwamba itakuwa bora iwapo serikali itaweza kufungua miji hii miwili ama wakati bado? Na iwapo mtafungua, wale wazee ambao wako nyumbani, je, mmeweka mikakati zipi ya kuhakikisha kwamba Wakenya hasa wenyeji wa Nairobi na Mombasa hawatangamani nao? Maana mlisema kwamba wazee ndio wako katika hali hatari ya maambukizi haya.
My name is Mohammed Ali from TV47, and my question is, what is the situation in State House as per now as far as COVID-19 is concerned, and what is the state of the 4 people who tested positive? Thank you.
Thank you. Thank you all for your questions. I'll start with Ben's question on the community health volunteers. Like we've mentioned, our strategy really has evolved and moved towards having a community-facing front. And yes, we have actually trained 60,000 community health volunteers. This training was conducted primarily through an online platform known as LEAP, in cooperation with our partners in AMREF and different other developmental partners. And it's important to know that these volunteers have actually been volunteers who've been in the system, who have undergone a community health volunteers training module. And so these are not necessarily new, entrants into the health system. And so by virtue of them having experienced and worked with us and our different partners, they were then able to understand in terms of what was required of them from this platform. With regards to PPE, I'm happy to say, again, in cooperation with our partners, in particularly AMREF and different other organizations like Rockefeller, there are efforts to ensure that these community health volunteers actually have the requisite PPEs as they support us in the fight against coronavirus. And in terms of, questions that have arisen, most of them pointing towards opening. We have a question from Helen on the corporate council that was held recently, domestic flights. Is this a signal that we are ready to open? And I want to combine this with another question regarding counties in terms of bed capacity. Are the counties ready? Again, another question from Purity regarding COVID-19 response facilities. Are the counties ready? And really what it means is that for us to be prepared as a country, we've really, really highlighted this, and I think this was also articulated by the President in his summit with the governors, that really opening is really contingent on county preparedness. The fight has moved. The fight has moved from Nairobi. As we've said today, we are at the 41st county in terms of having positive cases. And so counties need to be ready. And what does this preparedness look like? Like we said, one, testing becomes important. And I think from the beginning, when we started with our 2 labs, now to almost more than 27 labs, we've improved there. And now in terms of supply chain shortages, I think we almost have, a good number in terms of the tests available. And so in that regard, we are hopeful that at least there we can put a tick, that we are prepared. We do have the requisite, strength and force and numbers in terms of testing. However, it's not just the PCR testing. We need to look at also what we call surveillance, syndromic surveillance within the community. And this is where our community health volunteers come in. And again, I'd say we tick this box. We have 60,000 of them up and ready trained. They're deployed in different counties. They are actually under the instructions of the county departments of health, and those are the people who offer, monitoring and evaluation services for these teams. So again, in that regard, we are ready. And then the key element in terms of treating, Right now, again, as a country, I can say we are sufficiently ready when it comes to treatment. We do have our case management protocols. We've shared them. We have our experts who contributed to these protocols. And we have actually had experience managing and having close to over 1,000 recoveries. So we know what it means to be able to treat and manage both an asymptomatic, mild, moderate, and severe COVID case. So again, there we have a tick. However, there is the issue of isolation. Isolation coupled with home-based care. And this is the area where we need to put a little bit more effort, and I know counties have actually made strides through the COG and the meeting that was held last week. The DG will give more information. Counties are getting there. Not all counties are ready. We are not at 47,300 bed capacity yet, but some counties have made strides, and we will be able to share with you this information. In fact, in the coming week, I'm aware counties have been asked and tasked by the president to literally ramp up their efforts to ensure that they're ready. And so again, we'll be able to give you highlights of what that looks like. And it's not just isolation beds, it's also ensuring, is your county able to deploy home-based care? Is your county able to be able to go and assess those homes and ensure that those homes are able to offer that service? Are you able then also, beyond having isolation beds, to offer critical care services? Do your facilities have the requisite oxygen? Remember, oxygen is really a very key medicine when it comes to COVID-19, particularly for moderate and severe cases. And so we are looking and seeing, and we do appreciate the efforts that counties have put so far, and we do hope that indeed, as Helen has said, within the next 1 week or so, we should be ready in terms of preparedness. Now, there is a fifth element of preparedness, and really that is the responsibility of you and I. Are we prepared as a country? Even as we put effort and, even as we ask our leaders to open up, are you ready as a Kenyan to be able to live in this new normal, where you have to contain yourself in terms of measures, you have to hand wash, you have to have your masks, and you have to learn how to be able to live in this new age of physical distancing. So that's also another parameter, and I really want each and every one of us to question ourselves, are we ready for that? I think there's been a question again in terms of, leaders flaunting, and really I'd say, as we said many times before, it becomes the responsibility of each and every one of us, and really true leadership dictates that, you can emulate, and you can provide guidance and leadership to your citizenry. And so we call on each and every person to adhere to these measures to help us when it comes to enforcing this behavior change. And one of the ways you can help us is, by actually practicing it in all the different convenings that you may have. Ensure that you practice the masking and that you practice the hand washing. We have good questions when it comes to testing capacity, in particular, how exactly we test. When we say today we have 2,400 samples ran, what is that procedure? How does it look like? How does it all come together? And I think I'll allow the DG to step in there and add in some more information there. And then there's also an important question, again, regarding opening. A question on whether once we open, have we put enough measures to safeguard our old people and our diabetics? And this is also a very important measure in terms of preparedness. Some countries have adopted different strategies. Others have taken on what they call sheltering those who are most vulnerable. So for example, if you're diabetic, if you're hypertensive, or you have any condition that affects your immunity, the idea is that you continue to work from home. And I think you'll see this in our protocols, even as we try and come to a new normal and, some form of gradual new normal. It is important for employees to put in place those considerations. If in your workplace you have those people who may be afflicted, low immunity cases, old people, shelter them. And how you shelter them is allow them to work from home. Again, if it's our retired parents, grandparents, shelter them in their home place. Ensure that, that home is much more adept at ensuring that it's observing containment measures, and that also lifestyle issues, you're taking care of your diet, ensuring that, you're healthy and that you're adhering, to your medications. So that becomes quite an important approach. And going forward, you'll see a lot of sheltering in our protocols, how we can actually be able to come back to a new normal while ensuring we are protecting our most vulnerable in the community. I think I'll ask the DG to jump in, and if we've forgotten one more, I think we'll come back to it. DG.
Thanks, Madam CS. Regarding the measures we are taking to ensure that we lift the containment measures, of course, the President directed that each and every county should have a minimum capacity of 300 beds for isolation of COVID-19 cases. Progress has been made in this line. And we have just finished a National Emergency Response Committee meeting. We'll be able to give you feedback on the information that is coming from the counties. But that notwithstanding, again in our meeting on Thursday in State House, we agreed on 6 key parameters that are a basic minimum that will determine whether we lift the containment measures or not. One of them, of course, is the emergency preparedness, again at the county level, especially the establishment of the rapid response teams to be able to deal with these cases when they arise. And we simply don't want the county health management teams establishing the RRTs, but they should be scaled down to the sub-county level where the cases, of course, will come from. Number 2, of course, is enhancement in terms of case detection and case management. And we have done capacity building for the training of trainers for the county health management teams, and it is expected that this will be cascaded downwards to the sub-county and also the community health volunteers, more so now that we are rolling down the home-based care protocols. Number 3 is in terms of risk communication. We challenge each and every governor in their respective areas of jurisdiction to be able to have dialogue with the people in their counties so that they can be able to communicate what each and every county is doing towards COVID-19. If you look at the breakdown of cases that we have for COVID-19, we know 2 counties now have established community transmission, that is Nairobi and Mombasa. About 3 or 4 counties are having large clusters, and basically this is because of truck drivers. That is basically Busia, Kajiado, and Kiambu. Then a big chunk of the counties have what we call small clusters. And then counties like Lamu, where we have only reported the first cases today, we refer to that as imported cases. So a big proportion of the counties can be able to put these measures into place and quickly stamp out further transmission of COVID-19. But pillar number 4 is laboratory testing, which was also asked by one of you. Currently, we have 28 laboratories spread across the country offering COVID-19 tests, both in the public and the private sector. And we want to enhance this further. Initially, we thought that we'd be able to get the Gene Expert cartridges, which are placed all over the counties throughout the country. But where we expected to get these cartridges, we have hit some headwinds. But that notwithstanding, we still have a proper sample referral system that is in place. That is why we can be able to test a sample from Turkana or from Mandera, however expensive it is. So it simply tells you that the government will not leave anything to chance if it comes to the issue of testing, which is critical for stopping the transmission, because it is only after testing that will determine who is positive, who requires isolation, and who requires to go for quarantine. Pillar number 5 was the public health and social measures that we need to undertake, including inter-county movement, which again we threw this responsibility to the governors. And we have developed simple templates at the points of entry, like if you are crossing from, say, Kiambu to Murang'a County, we have a simple checklist. You'll have your temperature checked. And of course, there's also a trial system, simply asking you whether you have cough or difficulty in breathing. We'll be able to pick about 80% of the COVID cases. So this is simple application which will not require a lot of resources. And we think if we can be able to do this, then it is very likely that we'll open the economy. And the final pillar, of course, is the infection prevention control measures that Madam Waziri has articulated very, very well, but with a focus to be able to shield the elderly and the vulnerable. And we are telling the counties that the resources we have given you, we can be able to map out the elderly people or those with pre-existing conditions so that you can be able to supply them with masks. And because manufacturing or local manufacturing of masks is now taking place at the county level, even cloth-based masks would equally do a good job. I think that answers Purity's question about the facilities. The counties which have the facilities to be able to test, we have 28 labs spread across 12 counties. But of importance is that we have a fully functional sample referral system, which we have used for TB, HIV previously, and we are simply riding on that platform because we don't have the reagents for the gene expert machines which are distributed throughout the country. And we thought that would have been a very good platform to ensure that all counties have capacity to be able to test. But that notwithstanding does not mean that this is the end of the road. We are still exploring further possibilities of placement of various equipment with some manufacturers. Then we simply get the commodities from them, especially in far-flung counties. We are really concerned about Mandera and Turkana. For example, in Turkana, from Lodwar to Nadapal is 400 kilometers. So if you get a case, suspected case in Nadapal, you have to travel 400 kilometers, then get that sample back to Eldoret, which is now 500 kilometers. So the turnaround time then is grossly increased. And when we do this, we'll give priority to the far-flung counties and, of course, countries which are experiencing large clusters and also intense transmission. Thank you.
I think there was one more question where Purity was asking if, we'll allow people to move back home because of rent challenges and issues in terms of the economy. And really what we're saying is that it becomes really important, like we've said, to be ready first before such measures can be deployed. And so for now, all the containment measures remain in place as the NERC continues to review progress, as counties continue to submit their level of preparedness, we will then be able to make a determination to that. There was also one more question regarding the situation at State House, and I think there what we're saying is that for all institutions, we are really ensuring that there's a lot of testing. I'm sure you saw last week there was testing at the Ministry of Lands, there's testing happening at Parliament, testing happening in different organizations at the judiciary, and this continues to be the same for all institutions. I think we've been able to cover that, unless TJ you can add on. Yes,
that
the
statistics
infants.
Maybe tomorrow in our brief. The breakdown of infants, adults, elderly, those with coexisting conditions. We can be able to give you that information by tomorrow. Yes, Mark.
Okay, thank you very much. I have two questions. One is about the protocols for opening up of churches. And number two, I've just received a message from a public health officer who was hired in March in Kilifi. They say they haven't been paid up to now. Thank you.
Fantastic. I think we'll start with the last question. What we are doing right now is we are happy to note that the funds are available. Healthcare workers will be paid, and it's a process that should be happening going forward. Again, we continue to urge county governments to continue supporting the healthcare workers who are working to ensure that this virus is stamped out. So there's good progress. There's good progress. In terms of the protocols of churches, I think I'll ask Mr. Kefa to come in because he's actually our focal point when it comes to the churches, and he can share with us some more details on that. I'm not sure.
Thanks, Cass. I'm sure you followed the brief from the chair yesterday, and the answer is an interim report will be given in a week's time. Thank you so much.
Thank you.
This is NTV.